I'm Dr. Caroline Fife from the Memorial Hermann Hospital in Houston, Texas. I've been using transcutaneous oximetry, often known as TCOM, or more accurately, TCPO2, for the past 20 years. Transcutaneous oximetry is a non-invasive way to measure the oxygen tension, that is, the partial pressure of oxygen in the skin. The 4 applications of TCPO2 we will discuss in this video are assessing the wound healing potential, screening for vascular disease and/or assessing the success of revascularization, predicting amputation level, and predicting the benefit of hyperbaric oxygen therapy. I will refer to evidence-based interpretation guidelines developed by an expert panel and published in the Journal of Undersea and Hyperbaric Medicine. First, let's briefly review just what it is we are measuring. My home in Houston, Texas, and here in Stockholm, where we are making this video, are exactly at sea level, where the total atmospheric pressure is 760 millimeters of mercury. Since 21% of that is oxygen, the inspired partial pressure of oxygen is 160 millimeters of mercury. This is diluted in the lungs with water vapor and carbon dioxide, so that if we were to measure the oxygen partial pressure in the arterial blood, it would be approximately 100 millimeters of mercury. Oxygen is then carried via the vasculature to the tissues, where it is possible to measure its diffusion through the skin using a heated electrode to 44 or 45 degrees centigrade. The transcutaneous oxygen tension in a normal person is about 70 millimeters of mercury. Values lower than 40 millimeters of mercury are associated with impaired wound healing, and values lower than 30 millimeters of mercury are indicative of critical limb ischemia. But it is important to know that a low value could have other causes besides vascular disease. For example, the patient's inspired PO2 could be low, perhaps because they live at altitude, or their arterial PO2 could be low due to pulmonary disease. They might have a poor oxygen delivery mechanism due to heart failure or peripheral vascular disease. Or lastly, they may have a barrier to oxygen diffusion to the electrode due to edema or inflammation. A best practice suggestion is to check the patient's oxygen saturation using pulse oximetry to ensure that arterial hypoxemia is not the reason for a low TCPO2 reading.